This is our Country Profile Project Part 2 for Nigeria and is by Andrea Ward, Madison Marbury, Meredith Robinson, Sean Boldrin, and Tori Giordano.
Communicable diseases. As of 2019, 6 of the top 10 causes of death in Nigeria were a communicable disease. This includes malaria at number 2, diarrheal disease at number 3, lower respiratory infection at number 4, HIV/AIDS at number 5, tuberculosis at number 9, and meningitis at number 10. Malaria being the second most cause of death in Nigeria, it is important to highlight the efforts being made to reduce this statistic. Measures such as the distribution of insecticide-treated bed nets, improving diagnostics, monitoring malaria-related activities, as well as malaria prevention medicine have been taken to fight this endemic. I would also like to mention the statistics surrounding COVID-19. Nigeria is considered to have a level 2 moderate risk of COVID-19. There have been 213,147 confirmed cases, 2,968 deaths, and as of November 8th, 8,929,327 vaccine doses administered. Communicable disease success story, poliovirus. As of August 2020, Nigeria was officially declared free of poliovirus. Such efforts were supported by the CDC for the past 10 years, which include a series of measures taken to reduce the spread of poliovirus. Among other measures, this initiative consisted of surveillance programs, data collection, and vaccine distribution. Included in this effort to end poliovirus infection in Nigeria was the use of vaccines to not only prevent polio, but also other communicable diseases. From 2015 to 2019, Nigeria saw a 20% increase in routine immunizations. Fieldwork such as this not only aided in the elimination of polio from Nigeria, but also helps to prevent other communicable diseases.
When looking at low-income countries like Nigeria, a lot of times we only think of communicable diseases. But here we see that in 2018, a WHO report stated that non-communicable diseases accounted for 29% of deaths in Nigeria. We see that non-communicable diseases is the issue here. Some of the primary non-communicable diseases responsible for death, here ranked from most to least, is cardiovascular diseases, cancers, chronic respiratory diseases, diabetes, and some other ones include sickle cell disease, violence and injury, and one sort of unique to low-income countries is NOMA, which is an oral disease caused by malnutrition in children. Here we have a table from a study that shows prevalence of non-communicable diseases and cardiovascular risk factors for a certain region of Nigeria. So we can see some of the high risk factors include smoking, alcohol consumption, and physical activity, leading to non-communicable diseases such as hypertension, diabetes, and high lipid levels, which usually means an excess amount of fat in the blood. In class, we have discussed the idea that non-communicable diseases can be just as much of a burden as communicable diseases, and sometimes even more of a burden if not addressed. It has been found that in order to take care of these non-communicable diseases, there is the need for further implementation research and policy directions to tackle non-communicable disease burden in urban communities in Nigeria. These strategies must be community-specific, prioritizing the various risk factors and addressing them accordingly. That was a statement from the study where the table was shown. And we've seen this in class before. We know that in order to reduce non-communicable diseases, there is many times the need for changing behavior, just like the quote above says that the strategies must be community-specific. And we know that changing behavior can be extremely difficult. So tackling these non-communicable diseases can be quite the challenge.
Malnutrition is an epidemic in Nigeria that is a growing problem. UNICEF states that 5 in 10 children under the age of 5 in Nigeria suffer from the effects of being malnourished. This has an overarching impact on the lives, future, and productivity of Nigerian children. Malnutrition and poverty are closely linked together. People who live in poverty are more likely to be malnourished. Those who are severely malnourished are typically stuck in poverty. The two go hand in hand. COVID-19 has worsened the malnutrition epidemic in Nigeria. The pandemic has led to an increase in cost of living, which has had a detrimental effect on Nigerians' nutrition. Prior to COVID-19, 4 in 10 Nigerians were experiencing extreme poverty based on monetary statistics. The poverty issue in Nigeria transcends beyond monetary measures. Poverty affects various aspects of Nigerians' everyday lives, including poor health, lack of education, insufficient living conditions, decreased opportunity for work, increased risk for violence, and disempowerment. The multidimensional poverty Nigerians are facing results in both direct and indirect effects on malnutrition. Prevalence of malnutrition in Nigeria is expected to increase due to the expected increase in multidimensional poverty. The amount of malnutrition and issues for malnutrition differ from region to region. This growing issue is not able to be fixed by one solution, but needs to be addressed carefully and specifically for each region. Data from the 2018 Nigeria Demography and Health Survey suggests that Nigerians' northern states suffer from malnutrition significantly more than southern states. The proportion of children who are too thin for their height in northern regions is twice that of children in southern regions. This graph highlights the regional differences in malnutrition Nigeria is facing. You can see the northern regions have significantly higher prevalence of stunted children versus the southern states. Multidimensional poverty having a close association with malnutrition, the solution must also be multidimensional. Educational programs in local communities to teach Nigerians about appropriate diets, the importance of breastfeeding for the first 6 months, importance of supplements such as iron and vitamin A, government intervention at all levels, being local, state, and federal, is also necessary in order to fix this issue. Nigerian households should have access to clean water and be able to practice proper hygiene routines. Specific supplements should be dispensed in the community, such as nutritional supplements and fortified foods. UNICEF is currently working with the Nigerian government to execute a national plan of action on food and nutrition. This plan will focus on strengthening health within local communities and making nutrition a priority in all aspects of primary health. There are 2 main points of focus in this plan, being community management of acute malnutrition and infant and young child feeding. Malnutrition has negative effects on the Nigerian economy as it leads to an increase in costs. Malnutrition results in higher health expenses within households due to higher frequency of sickness. There is a greater risk for chronic illness, which results in more costs due to medications and health visits. People who are malnourished are more likely to suffer from both cognitive and physical impairments regarding development. Malnutrition also hinders a person's educational ability and economic productivity potential. Malnutrition results in a weaker immune system, which raises the risk of developing a more serious infection such as marasmus and kwashiorkor. Maternal and child health in Nigeria is also a huge concern. Some statistics to show this are 20% of all global maternal deaths happened in Nigeria, and in 2015, maternal mortality ratio was greater than 800 maternal deaths per 100,000 live births. There were approximately 58,000 maternal deaths in Nigeria in 2015. The chance of a maternal woman dying before, during, or after giving birth in Nigeria is 1 in 22, whereas the chance of a maternal woman dying in a developed country is 1 in 4,900. Nigeria also has the second highest number of deaths in children under 5 globally. An estimated 2,700 children die each day in Nigeria, and for every 3 births in Nigeria, only 1 is born in a health facility. The main reason for these high numbers is due to inadequate access to healthcare. The large socioeconomic gap between the wealthy and poor is also a leading reason for the high MMR. On a global scale, more than half of maternal deaths are in sub-Saharan Africa. Nigerian women in rural areas are less likely to have proper access or to ask for help than women in urban areas of Nigeria. The rural woman in Nigeria will typically have unassisted births. Vaccination rates in Nigeria are also extremely low in Nigerian children. Only 1 in 4 children are fully vaccinated, and in rural areas, 16% of all children are fully vaccinated, versus in urban areas, 40% of all children are fully vaccinated, which highlights the socioeconomic gap.
With the increasing climate change, the severity of natural hazards and communicable diseases continue to worsen. Furthermore, in Nigeria, toxic substances are yet to be fully recognized according to the WHO. Some of the environmental issues regarding public health in Nigeria are air pollution, water pollution, oil spillage, deforestation, desertification, erosion, flooding, lead-based paint, structural issues, inadequate sanitation and heating, electric and fire hazards. The air pollution includes household and ambient pollution. Nigeria also experiences concerns with environmental hazards and insufficient basic needs of the people. Programs have proven inadequate as small growth has been made. Air pollution is one of the top 10 risk factors contributing to most death and disability combined in Nigeria. Air pollution causes minor and significant health problems, including irritated eyes and breathing problems, or even respiratory diseases and mortality. Furthermore, air pollution can lead to cardiovascular diseases, tuberculosis, respiratory infections, chronic obstructive pulmonary disease, ischemic heart disease, stroke, maternal, neonatal, and nutritional diseases. Nigeria is amongst the world's worst 5 countries regarding premature death associated with air pollution.
In 1976, the federal government of Nigeria established the National Emergency Relief Agency, NERA, to coordinate its disaster response activities. The main issues that Nigeria faces are with drought and flooding. According to the Nigeria Post-Disaster Needs Assessment, PDNA, the 2012 floods killed 363 people and injured over 5,000 people. Over 3 million people were affected and 387,000 people were displaced, according to the Global Facility for Disaster Reduction and Recovery in June 2013. Another issue that Nigeria faces is with internally displaced persons. The CIA World Factbook reports that there may be as many as 3 million internally displaced persons, mostly in northeast Nigeria. The causes of these internally displaced persons may be varied. However, there is a common thread of health issues. We see issues with communicable diseases, maternal mortality increasing, and other issues in these groups, mostly because of the lack of access to care.